And my time starts now. Good morning. So as I thought about my remarks today, I thought I'd take you back to when I came here to VCU. That was in 2012, and then share a story about what community engagement means to me. In 2012, I came here to VCU, and two colleagues, Pam Parsons and Patty Slatum, really my mentors, said, don't you want to go provide care in the community? Go provide care in places where they need it most. Rather than asking patients to come to us, let's deliver care where they need it most. And so that's what we did. In 2012, we started at Dominion Place, which is right off this campus in Monroe Park. And it's a Section 8 housing building that caters to older adults. Those are 65 and older. And really, we focused on the dual eligibles. So those are Medicare and Medicaid, so older adults and underserved. And we thought it'd be a great idea to take an interprofessional model of students into the community to deliver this care. And so we take nursing, pharmacy, social work, medicine students into the community and say, help these residents. And more importantly, before we started, we asked the residents what they needed of us. And so they identified high blood pressure, diabetes, mental health, and we started there. And so once a week, we're in that building providing care, trying to triage some of the medication-related problems, but also those social determinants of health. Do they have transportation? Do they have funds to get their medications? Do they have the necessary food that they need? And so that model continued to grow. We received HRSA funding in the amount of $1.5 million over 3 years to refine and replicate that model. And so what's been neat is we've actually been able to grow our program to 5 distinct buildings across Richmond and provide the same type of services with that interprofessional team. And so when I think about community engagement, and I thought about these remarks, I thought I'd tell you what it means to me and kind of take you through my thought process. But I had an interesting experience yesterday, and Tracy and I were talking about this. We had a candidate that was coming in to interview for the I-Cubed initiative, which stands for Innovation, Inquiry, as well as inclusion. And the candidate, without divulging too much, comes from the Midwest, is African American, does pharmacogenomics research, and his focus has been how do we determine how medications work in certain populations and why they may not work for others. And so the idea was to bring him into our team to maybe further that evidence base, further that research. And so Patty and Pam took him out into the community to some of our buildings where we deliver care. And he said to me, this is like going to church. And so for most, that may not have a connotation or a certain meaning, but to me, I knew exactly what he meant. And that's really the essence of community engagement, is where you are able to identify with your patients or your residents, and residents are able to identify with you. And that's what community engagement is. Having that relationship at the foundation or the core of what you do. And for me, the relationships that I form with my patients drives everything else. The grant funding, the collaboration, the research efforts, and that's what's most important. And so Mrs. Jones is someone that you may have met that's been featured throughout our time here at VCU. And she's a resident that I still, even though in my new role, I still visit from time to time. And so I went over there on Monday, and she's a resident that never minces words. And so she asked me, have you guys started having your kids yet? And I said, Ms. Jones, we're not there yet. We're not ready. But that's the type of relationship we have. And I think when you have those relationships, everything else comes together. And so community engagement really, to me, is about forming those relationships that are going to be impactful not only for that community, but also for the faculty and students that partake in it. And so with that, I look forward to talking with you.